A lot of persons actually believe that a headache is just an ordinary headache. There are different types of headache, and also headache depends on the intensity, the duration, and the frequency it occurs in the human body. Right on this video, I'm going to tell you a lot of things you need to know about headache. What causes an headache, the different types of headache, how to identify the type of headache you are having, and also the home treatment and the simple medications that can be used in the management of headache at home. Hi guys, welcome to my channel. I am Pharmacist God's Gift, and on this channel I talk on health matters and I give you top information on drugs for minor ailments. If you have ever had a headache, I would like you to click on the like button, and also if you're new on my channel, please click on the subscribe button and put on the notification bell so you will be the first to get notified on my new video. Welcome back. Actually, it's not every headache that is just an ordinary headache. Headache has different types, and also it comes in different duration and frequency. There are two types of headache, which is the primary and the secondary headache. Primary headache includes the tension headache and the migraine, and over 90% of persons usually comes up with this primary type of headache. Let me tell you what you need to know about the tension headache. The tension headache is the type of headache that affects both sides of the head. That is like a steady ache in both sides of the head. The tension headache makes you feel as if your whole head is banking you. Then what about the migraine headache? The migraine headache is just one-sided type of headache. Like that headache that you will say that it's just one part of your head that is paining you. That is the migraine type of headache. And also migraine headache comes with one having the feeling of wanting to throw up, that is nausea. And also the person with migraine headache will be very sensitive to light and sound. The tension and the migraine headaches, which are the primary type of headaches, are the most common type of headache that is found among over 90% of patients or individuals that come up with the cases of headache. Now let's look at the secondary type of headache. The secondary type of headache is as a result of underlying disease conditions such as hypertension, infection, malaria, tumor, and a lot of other diseases. And these secondary types of headache occurs in 10% of patients that comes up with the cases of headache. Now you can see that the percentage of the secondary type of headache is 10%, and that of the primary type of headache, which consists of the migraine and the tension headache, is 90%. So persons usually comes up with the primary types of headache more frequent than the secondary type of headache. Like patients with high blood pressure, when their blood pressure is increased, they have the tendency of coming up with secondary type of headache. Now let's move to what causes headache. A lot of things and conditions can lead to a headache, and also headaches are more common in the female than in the men. And I'm going to show you reasons for that, and these are the causes of headache. It is advised that you know the causes so as to prevent or reduce the risk of coming up with an headache. The number one cause of headache is physical factors. Examples: not getting enough sleep or sleeping too much, not eating very well, and also injuries, and a lot more are the physical causes of headache. Now let's go to the dietary causes of headache. The dietary factors of headache include excess alcohol consumption, excess intake of caffeine, chocolate, cheese, and a lot more are the dietary causes of headaches. What are the emotional factors that lead to headache? The emotional factors that lead to headache include stress, depression, anxiety, and also feeling too excited or shouting too much, like our mothers that shout a lot, though we know that most of the times they comes up with headache. Now let's go to the environmental factors that lead to headache. The environmental factors of headache include strong odors or looking too direct into the sunlight and a lot more. Now let's look at the hormonal factors of headache. The hormonal factors of headache include menstruation, use of oral contraceptives, menopause, hormonal replacement therapy, just to mention a few. Now you know that a lot of females come up with headache more than the male. As a result of these oral contraceptives, a lot of females use menstrual flows that comes cramps and headache, and also menopause that affects older women. Since you've known the type of headache, what causes this headache, now let's go to the simple home remedies or the simple medications that can be used in the management of headache at home. The first thing to do in the treatment or management of headache is to prevent the triggers or what causes this headache. That can go a long way to reduce the headache. If it's stress that is causing your headache, you will have to take a rest to reduce headache. Also, I will advise to take a glass of water and get enough sleep. This can also help to reduce headache. Finally, the drug therapy used in the management of headache involves the use of over-the-counter painkillers like the analgesic examples, the ibuprofen, the aspirin, the diclofenac, the naproxen, the paracetamol, the aceclofenac, and a lot of them. All those are used in the management of headache at home. Secondly, the muscle relaxants. These are usually prescribed by the health provider. They also are good to reduce headache. Thirdly, since headache is as a result of underlying disease condition, antihypertensives too are good or useful in the reduction of headache. Finally, other drugs like the opioid analgesic and the rest are also good for the management of headache. But these drugs are usually prescribed by the health professionals, so you don't need to go get them yourself. But the ones you can get for yourself easily are the over-the-counter painkillers, which are used for the management of minor pains. Therefore, if you take a glass of water, you take a rest, and you also make use of your over-the-counter painkillers, and you notice that the headache still refuses to go off, I would like you to quickly go see your health provider, because it might not be a primary headache, which is as a result of tension headache or migraine headache, but rather it might be as a result of secondary headache, which comes up as a result of underlying disease condition. Therefore, don't just say every headache is just an ordinary headache. It might not be just an ordinary headache, but headache that is as a result of other disease conditions. Thank you for staying tuned till the end. I hope you really had a good knowledge on headache today. Please don't forget to like, subscribe, and click the notification bell.